is an incredibly important and timely topic. So I'm really glad for this opportunity to talk about it. While today's discussion is going to be specific to Maui, it is important for oncology nurses to understand the broad implications of wildfires to the health of cancer patients everywhere. So I just want to quickly use some examples to highlight the importance of this. Just looking, let's say, at the surgical treatment outcomes of wildfires, a very recent study from researchers from Emory University, the American Cancer Society, and Yale University showed that people exposed to wildfires within a year after having lung cancer surgery have significantly lower chances of survival compared to lung cancer patients who were not exposed to wildfires. So the health impact of climate change related events like wildfires is really multifaceted and much further reaching than we as conventional oncology nurses may typically think. So in addition to the health consequences on outcomes of surgical patients like lung cancer, there's the primary consequence of inhaling that fiery smoke, that kind of air pollution. There is an interruption in care. And we know the anxiety, obviously, in any population is going to go up, but our patients are unique and they are already predisposed to higher incidence of anxiety and even depression. This can be related to challenges in receiving the care that they need during cancer treatment, and it can honestly be related to the financial hardship. There's mental trauma that we're going to see, and we really need to work together to have a positive impact on the negative consequences to people's health and well-being. So look, I'm kind of quickly walking you through the cancer care continuum, starting with treatment, but I'm going to bounce back to cancer control. President Biden has reinitiated cancer moonshot. So oncology nurses everywhere are committed to looking at that through the lens of cancer control. Here we go. Another study from McGill University found that people living within 50 kilometers of wildfires over the past 10 years had a 10% higher incidence of brain tumors and 4.9% higher incidence of developing lung cancer compared to people living away. So we have to keep in mind what is our mission as oncology nurses. Our mission starts from cancer control and prevention all the way through the continuum. I'll tell you, each geographical area of the United States really has its own unique challenges in wildfires. Not one is cookie cutter of the other. However, Maui is no different. So the recent wildfire crisis in Maui has caused many challenges for hospitals in the things that you would automatically think about in caring for cancer patients. Hospitals on the island of Maui are absolutely overwhelmed with burn patients and people suffering from smoke inhalation. Caring for those injured in the wildfires has been hampered by the difficulty of transporting patients to other facilities. Now, in addition, some Maui patients have been left without medications, medical supplies, and access to cancer treatment, as well as food, basic necessities like food, clean water, and shelter. Fortunately, the American Cancer Society is quickly responding to this crisis, but providing critical aid and resources for affected patients, including airfare, food, and lodging assistance. Mentioned before, the patients have been left without medication, medical supplies, and access to care, as well as food, clean water, and shelter. It's also important to understand that the implications of this can be seen in federal support. So economically, there's a very real aspect to the to helping support the cancer patients. This is just a little touching on the facts at this moment. FEMA has offered $700 per household. So at the best of times, that wasn't enough, but certainly not now when you talk about displacement and loss of damage and medication. So many Hawaiians now, if you've been looking at the news, have been saying we don't feel necessarily like we're being treated as full-on US citizens. We saw this same reaction from many people on the island of Puerto Rico after Hurricane Maria and the subsequent climate events that followed that. So really, Maui's private hospital system is in desperate need of more state aid. The community members need the aid. The hospital group that runs the healthcare systems in Hawaii is expected to request a state subsidiary increase for the first time since Kaiser Permanente took over their healthcare system 5 years ago. Now, all this to say that there speaks to a health policy aspect in patient care, both related to this event and all the others that have happened in the United States. And so for our audience, I would say, to make no mistake, nursing is political, and involvement in policy making is critical to the welfare of our communities. Today, we're talking about Maui. I guarantee you that you'll hear from me again in respect to other climate events impacting our unique populations in other areas of the United States and globally.